Okay, class. Assalamualaikum warahmatullahi wabarakatuh. Right. So now today lecture, we talk about the cervical vertebrae. Right. As you can see here, actually this is your cervical vertebrae. You have C1 until C7 vertebrae. Right. So we have seven vertebrae, cervical vertebrae over here. C1, C2, C3, C4, C5, C6, and also C7. Right. And C3, C4, C5, and C6 vertebrae, these vertebrae basically known as a typical cervical vertebrae, right? We call as a typical cervical vertebrae, whereas the C1, which is known as an atlas, C2, which is known as an axis, and also C7, right? C7, okay? And this vertebrae basically known as a vertebra prominens, right? And by the way, right now we try to focus on the typical cervical vertebrae, which is C3 until C6, right? Now I take one cervical vertebrae, typical cervical vertebrae over here, right? We try to explain about this vertebrae, right? So from what you can see here, this is typical cervical vertebrae, right? Okay, so this is anterior and this is posterior, and this is the superior view of the typical cervical vertebrae, right? So I took C4 vertebrae actually, right? So first thing that you should know is cervical vertebrae, typical cervical vertebrae, basically number one is it has something like very small body actually, right? Number one, small body, right? Shape, I think almost the same, is semi-spherical in shape, right? Where anteriorly it convex, right? And posteriorly it concave, right? And what you can see here, this is vertebral arch, okay? So this is the vertebral arch of the cervical vertebrae, typical cervical vertebrae. And also you can see here, this is vertebra foramina, all right? So this is the vertebra foramina or vertebra foramen, and you can see here this vertebra foramina or foramen basically small, right? We can say that this foramen basically oval in shape, right? Number one, small body. Number two, small vertebra foramina or vertebra foramen, and also it has something like oval shape, right? Number three, right, class. Number three, if you observe posteriorly, this is spinous process for the cervical vertebrae, right? And also interestingly, this spinous process basically you can see, it branch into two, right? It divide into two, right? So this kind of characteristics we call as this spinous process having a bifid spinous process. Bifid, B-I-F-I-D, bifid spinous process, meaning that spinous process is divided into two, right? So this kind of characteristics we call as a bifid spinous process, right? And number two is, right, the second special thing about the cervical vertebrae when we observe the transverse process. So this is the transverse process for the cervical vertebrae, typical cervical vertebrae, right? And what we can notice here, over here, can you see this foramen over here? Okay, and this foramen actually known as a transverse foramen or transverse foramina, or some would say foramen transversarium. Okay, and this transverse foramen is very, very important actually. This transverse foramen is very, very important, where it become pathway for arteries where supply your brain, and that artery will be vertebral artery. I show you something over here. All right. Okay, so this image actually show you this is the blood supply to your, right. This one of the artery which is supply your brain actually. Can you see this artery? And this artery known as a vertebral artery. In order to supply your brain, okay, in order to supply your brain, which is coming from your heart. It's coming from your subclavian artery. So this vertebral artery, right, in order to supply your brain, it must go through foramina. Okay, it go through your this foramen known as a transverse foramina. So this is what we call as a transverse foramina for the C6, all right? Transverse foramina for the C6, C6, C5, C4, C3, C2, and also C1. And all these vertebral foramina, all these transverse foramina, basically, this has become pathway for the vertebral artery, okay, for the vertebral artery. So back to your cervical vertebrae class, all right? All right, okay. Number one, small body. Number two, small vertebral foramina, and also the shape will be oval in shape. Number three is, in the transverse process, we have transverse foramina. These are the place where the vertebral foramen passing through. Number 4, we can say it's bifid spinous process, right? So spinous process basically divide into two, right? Next, actually, right, so what you can see here, this is superior articular facet and also this is inferior articular facet. These are difference between, so these are one of the characteristics where we can uh, differentiate, where we can make a comparison between cervical vertebrae, thoracic vertebrae, and also lumbar vertebrae by the directions of the facet. Okay, so if you notice here, class, right? Okay, so this is the superior articular facet, and also this is the inferior articular facet. Okay, this superior articular facet for the cervical vertebrae basically facing posteriorly and superiorly. It's facing posteriorly and also superiorly. Whereas the inferior articular facet for the cervical vertebrae basically facing anteriorly and also posteriorly. Okay, superior articular facet facing posteriorly and also posteriorly and superiorly, whereas inferior articular facet for cervical vertebrae facing anteriorly and also inferiorly, right? Okay. Okay, so this is your typical cervical vertebrae. Okay, class. Right. Okay. Now we continue, class. Okay. Now we continue. Right. So, C3 until C6 we classify into typical cervical vertebrae. Now we talk about the atypical cervical vertebrae. Start with C1. So this is C1. Okay, this is C1 actually. All right. Okay, C1 classified as atypical cervical vertebrae. Okay, or we can say this is something like weird cervical vertebrae. Why weird cervical vertebrae? Because number one, we can see that this atlas or this C1 basically doesn't have any body, right? Centrally, you can see there is no body over here, but laterally, these two structures laterally, this is what we call as lateral mass. Okay, so this structure basically we call as this part, right? So this part we call as a lateral mass. Okay, lateral mass of the cervical vertebrae or of the C1 or atlas. Okay, okay, that's number one. Okay, this C1 don't have any body, number one. Number two, it has two structures bilaterally, left and right, and these two structures known as a lateral mass. Okay, lateral mass, right? And these two lateral mass, right? If you observe superiorly, right? These two lateral mass basically connect by two arches. Number one, this arch we call as anterior arch, okay? And posteriorly, we have posterior arch, right? Okay, I repeat, this C1 don't have any body, and it has something like structure we call it as a lateral mass, and this lateral mass connect by two arches. Number one, anterior arch. Number two, posterior arch. Right? Right. Number three. This lateral mass superiorly and also inferiorly. These structures over here, these structures we call it as a facet. Same thing. We have superior articular facet, and also we have inferior articular facet inferiorly. Right? And also laterally, this transverse process for the C1 actually, right? It's almost similar to your typical cervical vertebrae, the rest of typical cervical vertebrae. And also this transverse process also have this transverse foramen, right? This become pathway for the vertebral artery, right? And also, yes, what you can see here, all right, this is the vertebral foramen for the C1. If you can see this structure, right, is quite big actually, right? This vertebral foramen for the C1 is quite big. Why is very very big? Because of, as you know, that this spinal cord towards the skull-like structure actually, this spinal cord become enlarged, right? It become enlarged, right? Why? Because of this spinal cord soon will develop the medulla oblongata, right? Okay, so this is C1, right? Now we talk about C2. Okay, C2. Okay, so this is C2 actually, right? So I think this C2, I think it's very easy to understand because of this C2. You should remember this C2 actually, the structures that's almost similar to the rest of the typical cervical vertebrae. It has small body, right? it has in term of vertebral foramina, it has something like oval shape, right? Spinous process bifid. Transverse process consists of foramina, right? Transverse foramina, right? The superior articular facet facing posteriorly and superiorly, whereas inferior articular facet facing anteriorly and so inferiorly. But the different thing about this C2, which is known as an axis, with the rest of the typical cervical vertebrae, was this C2 consists of one finger-like projection over here. This finger-like projection known as a dens, or we can call it as an odontoid process. Okay, odontoid process. These are different between C2 and the rest of the typical cervical vertebrae, where this C2 consists of dens or odontoid process. All right. Okay, dens means finger-like projection. Okay, finger-like projection, where this projection basically facing upward, it coming from where? Body of C2, and this projection we call as a dens. And this dens actually, all right. So this is C2, am I right? So if you observe superiorly, right, can you see over here? This dens, actually, why we have this dens on the C2? Because this dens is very, very important because it articulate with your C1 over here. Can you see? Okay. So this is C1, am I right? So this is C1, right? Can you see, class? This is C1, right? Can you see? This is something like facet, articular facet. So this is the area where the dens will articulate into the atlas, right? Okay, can you see? So these dens actually articulate with anterior arch of C1. These dens of the C2 articulate with anterior arch of the C1. And if you observe closely, class, right? Sorry, all right. This articulation in between C1 and C2, am I right? By dens and also anterior arch of the C1, right? These articulations we call as Atlanto-axial joint. Atlanto refer to the atlas, axial refer to the axis. So this articulation we call as Atlanto-axial joint, class, right? Okay, so this is C2. I think C2 is very easy to understand. Please remember C2 is similar to the rest of typical cervical vertebrae, but the only difference basically when this C2 have a finger-like projection known as a dens. And this dens articulate with anterior arch of the C1 to form Atlanto-axial joint. Right. Okay. Okay, now the last cervical vertebrae was C7, all right? This is C1, C2, C3, C4, C5, C6, and also C7. This is C7 actually. I think this C7 is very, very easy to understand. Same thing, right? The structure is basically almost similar to the rest of the typical cervical vertebrae, but the only difference was if you observe the spinous process. Actually, the spinous process for the C7 actually is very, very prominent. It's very long. Okay, it's very long and deep, and it's pointed backward. Okay, backward and also inferiorly. All right. So, and also this spinal process, if you observe, right, it doesn't have bifid spinal process. Okay, it don't have any bifid spinal process, right? And that's why this C7, right? Since the spinous process is very, very prominent, right? And also it doesn't have any bifid spinous process, that's why this C7 we call as a vertebra prominens, right? We call it as a vertebra prominens. Okay. Okay. And the last one is, okay, before we finish our class, right? The last one is, all right, this C1, right? Please observe this C1, right? This is laterally, this is what we call as a lateral mass. Okay, this is what we call as a lateral mass of C1. Superiorly, we have superior articular facet. So this is what we call as a superior articular facet. This superior articular facet of C1, basically, right? Above, absolutely, we have skull. Am I right? Above, absolutely, we have skull structure, right? Over here. Okay. Okay. So okay, so this is C1 actually, right? So this is C1, right? Okay, C1, right? Please observe this superior articular facet. Okay, so this superior articular facet, all right, this superior articular facet actually articulate with which bone? It will articulate with your occipital bone. Above we have occipital bone, right? Can you see this convex surface? This convex surface. So this convex surface actually known as, I think you should know, right? Because of, I think the last lecture we talked about skull, am I right? Last lecture we talked about occipital bone. This convex surface, right, at the occipital bone, and this structure is known as occipital condyle. Okay, we call as occipital condyle, meaning that this occipital condyle, right, of the occipital bone actually articulate with superior articular facet, articulate with superior articular facets of the C1, and this articulation we call as Atlanto means atlas, occipital, occipital joint class, right? Okay. All right. I think that's all for today class regarding your cervical vertebrae. And thank you.